As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier, where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
Welcome to Leyla Weighs In here on Intelligent Medicine Podcast. Thank you for your comments, your emails, your questions. We appreciate them. That email is questions@drhoffman.net. That is questions@drhoffman.net. If you don't already subscribe to the Intelligent Medicine newsletter, you should do it. Go to drhoffman.com and sign up. You'll get my half of the newsletter typically earlier in the week, Dr. Hoffman's half a little later in the week. So you have two opportunities to read, and it's better formatted if you're reading from your mobile device, your tablet. It's a little easier. It's formatted properly for easy navigation. We never use your email for spam or anything like that. If you'd like to make an appointment with me, call the number 212-779-1744. That's 212-779-1744. I want to talk to you today about nutrition and menopause. It's an important developmental phase within a woman's life cycle, menopause is. And it's the transition from your reproductive years to non-reproductive years, because the sex hormones, they change, they level off, they diminish, and no more monthly periods. That's menopause. And typically they say if you've not had a period for over a year, you are officially in menopause. Now, menopause can occur as part of natural biological aging or as a result of surgical or medical procedures, right? If you have total hysterectomy or anything like that. And menopause has been associated with an increased risk of some chronic diseases, from cardiometabolic dysfunctions to musculoskeletal conditions to chronic pain. Many of you, ladies, have experienced pain of some sort, whether it's muscular or feeling like it's a tendon ligament thing, but just pain, bodily aches and pains. It may be due to perimenopause and menopause. The timing of menopause may also be linked to increased disease risks, with early menopause associated not only with higher cardiovascular disease risk than later menopause, but also with higher potential risk of chronic kidney disease as well as dementia. So across the stages of menopause transition, as estrogen levels are dropping, impairment of endothelial function, right? That's the function of your arteries, the smooth muscle in the inside of the arteries, endothelial function, and acceleration of vascular aging. These have been noted across the stages of menopause transition. Now, in addition to that, obesity, cancer, endometriosis, cardiovascular disease, and poor cognitive function. These are all marked by gut dysbiosis and can be considered estrogen-modulated conditions. So more broadly, hormonal changes among those who are aging have been associated with greater risk of frailty and disability, likely due to disruptions along several hormonal axes rather than deficiency of a single hormone. So let's talk about lifestyle and menopause. Research studies continue to emphasize the importance as well as the benefits of incorporating or enhancing lifestyle-based approaches like nutrition and exercise, because you want to counter these increased risks and promote health at menopause and during the postmenopausal years, so-called third chapter of our lives. So, there are Mediterranean-based diets that may be helpful. Nutrition, because it's an important pillar of lifestyle intervention, I would say 80% of it, really. More than exercise. Exercise is very important. Don't misunderstand me. And they go together. But how we feed ourselves is definitely at least 80% of it. So a Mediterranean type diet, all of these things. Nutrition is an important pillar in lifestyle intervention. And it can impact hormonal balance. It can, at the most basic level. Consumption of anti-inflammatory foods like vegetables, fruit, they may alleviate symptoms of many chronic conditions associated with increased inflammation. So what are inflammatory foods? All your ultra-processed foods, the vegetables, seed oils, too much omega-6, artificial sweeteners, things of that nature, additives, preservatives, emulsifiers, all of those kind of things. Get rid of them because they're very inflammatory. Too many carbs is inflammatory. That, for example, too. Too many refined carbohydrates, especially. So reduced estrogen increases cardiometabolic risks for women entering menopause, but nutrition can make a significant difference in health impacts. For example, a recent study found that the Mediterranean diet has a cardioprotective effect for women during the menopausal transition and menopause, but only with high adherence to the diet. The cardioprotective effect included a lower resting heart rate, healthier cholesterol levels, lower triglycerides, lower C-reactive protein, which is a marker of inflammation, and clustered cardiometabolic risk. So Mediterranean diet includes the consumption of fish, so we're talking about omega-3 fatty acids, meat, and some of these noted cardioprotective results may be partly due to changes in fat intake. A 2023 meta-analysis of randomized controlled trials reported that among postmenopausal women, omega-3 fatty acid supplementation resulted in significant reduction in triglycerides and modest elevation of the so-called good cholesterol, the high-density lipoproteins, the HDL cholesterol. The report also indicated that while total cholesterol values were not affected, there was a modest elevation in LDL cholesterol levels. But you know what? That's okay. And as I've talked about in previous podcasts, because the HDL also goes up, you get a good ratio that ratio is important, right? So that's what we're talking about here. And how do you raise HDL? With eating more fat and exercise. So Mediterranean diet is not a low-fat diet. It's at least 40% fat, right? Now, during the menopause transition, vasomotor symptoms like hot flashes, night sweats, these are frequently reported. And nutrition can play a part in managing these symptoms and enhancing quality of life. Cross-sectional study based on food frequency questionnaires and survey responses only found that women who were in the menopausal transition and ate a vegan diet reported less bothersome vasomotor symptoms than those who ate an omnivore diet. That's very interesting. Also, a small study selected 2 diets, a lacto-ovo-vegetarian diet rich in omega-3 fatty acids and a lacto-ovo-vegetarian diet rich in extra virgin olive oil, compared their efficacy in reducing vasomotor symptoms in women entering menopause. While improvements were not reported for all evaluated vasomotor symptoms, the diet rich in omega-3 fatty acids showed significant improvement for reports of hot flashes. This is interesting. Now, there are other things that can reduce the hot flash symptoms. Decreasing your caffeine, your chocolate, red wine, sugar, all of these things contribute to hot flashes. Another thing, early menopause, because it sets us up for cardiometabolic risk factors earlier on, an average age of menopause for women is about age 56. If you've entered early menopause, say in your early 40s, mid, even late 40s, that's still kind of early. However, if you were on a poor diet, and when I say poor diet, I'm not just talking about a really poor diet like the standard American diet, the SAD diet, but just eating too many carbs in general. When you lower your carbohydrates and really embark on a low-carb, high-fat diet, you may find that you start menstruating again. Yeah. So that early menopause, I don't want to call it fake. I don't want to call it fake, but it shouldn't have happened that early. It had to do with your diet and lifestyle. If you were on a high-carb diet, could be why you went into menopause that early. Because menopause should really happen later, in like the mid to late 50s. That's really what we're talking about. Many women have reported this who had gone into menopause, have been in menopause for years, but then they embarked on a low-carb diet, their metabolic abnormalities were correct, and they started menstruating again. Lo and behold, in their age 53, 54, they hadn't menstruated since they were 45 years old, as an example, right? Now, premenopause, we see the same phenomenon in women who have issues in their 20s and their 30s, or who have PCOS, which obviously adversely impacts fertility, right? Polycystic ovarian syndrome. That's a metabolic abnormality caused by high insulin, hyperinsulinism, right? We keep asking the question, which comes first, the high insulin or the PCOS? The high insulin is driving the PCOS because when we correct the diet and place them on a low-carb, high-fat diet and correct the hyperinsulinism and the PCOS goes away, this metabolic abnormality goes away, those women start menstruating normally again and become pregnant. Fertility issue resolved. And it's the same kind of thing we're seeing in women later in life with this earlier kind of menopause. You could be saying, oh, but my mother had an early menopause at age 44 or 48, and therefore I am too. Well, how is your mother eating? That's a good question to ask, because it doesn't necessarily mean that it's going to happen that it should happen that early. Overall, what kind of diet are they following? The more we know that our genome, our microbiome, we're basically set up to not be eating so many carbohydrates, and certainly not so many of the other things in the foodscape, your preservatives, your additives, processing, the emulsifiers, the things that cause, damage to the GI tract, inflammation, all of that kind of thing. That's what we're talking about here. So when you correct for all of those things, a lot of things just right themselves. When you're eating in a healthier manner, not all these carbohydrates. Now, they mention here the Mediterranean diet. And you are to be reminded that a Mediterranean diet is not low fat. And those omega-3s are not just coming from fatty fish. They're coming from grass-fed meat. They're coming from pastured egg yolks, right? All of those things. A Mediterranean diet, a true Mediterranean diet, is higher in fat. And it's not based on all these whole grains and things. There is some, absolutely. But when you take it even further and make it even healthier, by making it a truly low-carb, high-fat, moderate protein diet, when I say moderate protein, I'm talking anywhere from 25 to 35%, not more than 35%. I would say between 25 to 30% would be optimal. That's ideal. That's ideal. And it corrects for a lot of metabolic abnormalities that I'm talking to you about here. And remember, even in this particular research that they looked at, that the Mediterranean diet has a cardioprotective effect for women during menopause transition and at menopause, but only with high adherence to the diet. And they do mention that the LDL cholesterol does go up. But here's the thing, and I've talked about this at length in previous podcasts, that while the LDL goes up, you get a better particle. You get a big, fluffy, pattern A, non-atherogenic particle. That's what we're talking about here. That's what's important. And cholesterol is not the foe, but I've gone at length about all this in previous podcasts. I'm not going to go into that at length here. We're talking about being healthy through the menopausal transition and in the post-menopause years. Now, I said earlier, by getting rid of certain things, whether it be the alcohol, the sugar, the caffeine, the chocolate, eating less carbs, that could take care of a lot of the hot flash symptoms. It can, right? Eating a healthier diet, that could take care of all of those things. However, a lot of women, they truly don't find relief unless they're taking some kind of HRT or BHRT. BHRT is bioidentical hormone replacement therapy, right? They're greatly helped by that. But for many women, they do fine when they make the diet changes, but you have to be willing to make them. Because healthy nutrition can affect both longevity and the quality of life in women at menopause and during the postmenopausal years. The later your menopause is, say mid-late 50s, where it probably should be normally, the longer good health years you will have in terms of any ensuing, heart disease risk factors that can happen with lower estrogen levels after the menopause transition and all of that. So healthy nutrition can affect both longevity and quality of life at menopause and during postmenopausal years. And understanding the significant health impact of lifestyle habits during this phase of life is important. One study found that health education interventions that focused on lifestyle modifications given to women at menopause improved sustainability of health-promoting behavior. And ultimately, when women would implement it and put it into practice, it improved their health status. So this is all food for thought for everybody. Now, again, the menopause transition happens across a continuum of years, of a couple of decades for many women. But it could be that the healthy menopause age, that transition, is probably mid to late 50s, the average age being age 56. But it depends on a whole lot of things, right? These are things to look at. If you were on a low-fat diet all your life, you're not supporting healthy estrogen levels even in your premenopausal years, and that could be a cause of earlier menopause. Listen up, ladies, that low-fat diet we've been told to be on all of our lives was likely a detriment, because low-fat meant high carb, and maybe that's why that early menopause set in. But it's not too late to correct these things. You can change your diet. Our bodies are very, very resilient. And you don't have to say, oh, but I'm already 60, I'm already this, I'm already that. Our bodies are really, really resistant when we take very good care of ourselves. And that's easy to do because that's everything within your control. You choose the food that you eat. You choose the food that you're going to cook, that you're going to prepare, and how you're going to feed yourself and your family. So, when we make these changes in diets, I see it in my clients. They start turning around within a matter of a couple of weeks. It's amazing. The vasomotor symptoms, they go away. They start to feel better. They shed excess water. Fatigue, skin conditions, sleep problems, all of these things abate. It's a wonderful thing to see. So healthy nutrition in menopause, yeah, it's a thing. It could lower all of your symptoms and make menopause not a trial or a tribulation that it's been so medicalized and set up to be. So, on that note, I want to thank you for joining me on another edition of Leyla Muedin. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.